This is an X-ray view of a human heart in action. It must beat more than 100,000 times each day if life is to continue. The heart muscle, our hardest working muscle. Its job is to pump blood through the thousands of blood vessels are of two kinds. The veins carry blood from the body to the heart. After the blood receives renewed oxygen in the lungs, the arteries carry it to the rest of the body. Heart failure due to diseases of the arteries is the greatest single cause of death in the civilized world. One of these diseases is high blood pressure. Blood pressure is easy to measure.
Is it high, Doctor?
It's a little high right now, but I want to check it again tomorrow, and maybe again after that.
Blood pressure may vary greatly in different people and in the same person at different times. For example, any tension or worry may cause blood pressure to shoot up temporarily. Medical science has associated high blood pressure with the condition of tiny arterioles, which branch out from the larger arteries. They are ringed with muscles which can increase or decrease their diameter. For example, note how tension contracts the arterioles. When the arterioles are contracted, increased pressure is necessary to force the blood needed by the body through them. This need for increased pressure causes the heart to work harder. For reasons not yet fully understood, the arterioles may become chronically contracted, and this is the cause of chronic high blood pressure, known medically as hypertension. At first, the heart will respond to this work by increasing in size, like other hard-working muscles of the body. If the demands on the heart are too great, however, it may eventually degenerate because of overwork. Here is a human heart of normal size. A heart enlarged because of extreme hypertension may be doubled in size.
Suppose I have high blood pressure. What'll it mean?
The general rule in heart disease, as in health, is to live up to the capacity of your heart, but not beyond it.
How do you mean?
I mean that the person with heart disease isn't necessarily an invalid. He can lead an active, useful life as long as he knows how much activity his heart can take. Now let's see.
Arteries are the source of another major disease called hardening of the arteries. Normal arteries are smooth tubes through which blood flows with a minimum of friction. In hardening of the arteries, tiny particles of fat are deposited in the lining of the arterial wall and cause a swelling and narrowing of the artery. At the same time, a chemical change may harden the artery. The medical name for this condition is arteriosclerosis. So great is the self-healing power of the body that when arteries do become sclerotic, others may. But if the hardening continues, the heart must beat harder to force blood through the narrowed arteries, and blood pressure goes up. The increased burden may enlarge the heart. Sometimes the arteries which supply the heart, called the coronary arteries, become sclerotic. As this model shows, the coronary arteries are richly branched in order to supply blood to every portion of the heart muscle. Sclerotic coronary arteries cause the heart to beat faster because of reduced blood supply and to fatigue more quickly. The increased burden tends to enlarge the heart. If the hardening process progresses to the point of complete stoppage, the surrounding tissue is starved for nourishment. The result is a heart attack, known medically as a coronary occlusion. A coronary occlusion may also occur when a blood clot forms and breaks away to be carried through the bloodstream. Blood clots may form for a number of reasons. Should a clot lodge in the brain, the result would be what is commonly called a stroke. Should the clot lodge in a coronary artery, the result would be a heart attack. This condition is relieved only with complete rest by the patient. The clot may eventually dissolve. If not, neighboring branches may enlarge so that new channels take over most of the work of the clogged artery. Diseases of the arteries cause some 90 out of every 100 deaths due to heart failure. 3 of the remaining 10 are caused by the third major disease we shall discuss, rheumatic fever. Rheumatic fever is usually a disease of young people. Medical science has recently discovered that most cases are preceded by a streptococcus throat infection. A few days up to 6 weeks after recovery from this infection, rheumatic fever may appear. The child doesn't seem to be very sick. There may be tiredness and lack of appetite, maybe a low fever. A characteristic symptom may be a slight swelling and pain in the joints, moving from joint to joint, since this disease attacks connective tissue throughout the body, including the heart. The valves of the heart are made of connective tissue. These valves are essential to the heart's normal pumping action. This is how a normal valve looks. These smooth leaves of connective tissue come together to completely close the opening. Its action is shown in this remarkable scene, photographed from inside the heart. The leaves appear translucent here because of the difference in lighting. Here is a similar valve in which the 3 leaves are scarred by rheumatic fever. Such valves are often called leaky. But science has found an effective weapon against rheumatic fever in the use of antibiotics. These drugs can't repair valves already scarred, of course, but they may prevent recurrence of the disease.
If I could have given you this medicine when you first had your sore throat, it's possible you may never have had rheumatic fever at all.
Can I ride my bike yet?
Not for a while. We'll have to build up to that gradually. Now let me listen again.
Faulty valve operation gives the rheumatic heart a characteristic sound called a murmur. Yet heart murmurs come from other causes too, and may not necessarily indicate heart disease at all. This is an example of the difficulty of arriving at a diagnosis. In diagnosis, several techniques are used in addition to physical examination. Most important is a complete history from the patient.
It happened just once before. Suddenly felt like something was pressing on my chest. I couldn't catch my breath. Had a sharp pain. Oh, it went away in a few minutes. I don't remember just how long. I thought it was indigestion the first time.
These may be the symptoms of hardening of the coronary arteries, but they might come from a number of less serious causes. Heart disease can't always be diagnosed with certainty, but great progress has been made in detecting the presence of the disease as early as possible. The physician has special instruments to help him in diagnosis, such as the electrocardiograph, which records electrical impulses originated by the heartbeat. Its record reveals minute irregularities and abnormalities which can't be detected by direct examination. The physician is able to look at an X-ray of the heart on a fluoroscope screen to observe its action, size, shape, and location. In special cases, an opaque solution is injected into the bloodstream to permit study of different phases of heart action. A dramatic new technique is the insertion of a tube called a catheter through the heart in order to measure the pressure and oxygen content of the blood in different heart chambers. Advances are being made in treatment, too, with the use of antibiotics, hormones, and other drugs. Dramatic new surgical techniques are used to repair defective or damaged heart and valvular tissue, as in the case of this valve scarred by rheumatic fever. The fight against heart disease is one of the major challenges in medicine today. The use of antibiotics has considerably reduced the danger of rheumatic fever. Other recent progress in diagnosis and treatment has brought new hope to those who suffer from heart disease and to the future millions for whom it is a potential threat.